My name is Catherine Ray. I'm Vice President of Clinical Development at Hemab, and I'm also a haematologist by training. And I came to work at Hemab really by a happy accident. So I had been working as an NHS doctor through the COVID pandemic in a big hospital in London. And I'd been working mainly with a group looking after patients with clotting problems. And I was just getting back to looking after some of the patients with bleeding disorders. And something that really struck me as patients were coming back into clinic was that a proportion had managed surprisingly well, whereas others had really struggled during the pandemic. And the difference was, you could see that the people with plenty of treatment options and good treatment infrastructure in the main had managed really well, and some had actually thrived with being able to be more independent with their management. But that was a stark contrast to some of the patients with other bleeding disorders who didn't have treatment options, who weren't well connected with the clinic. And many came back into the clinic really quite unwell, having not been able to treat their bleeds or control them or contact the people that they needed to get advice from. And it really underlined for me the unmet need between the two groups and real vulnerability of some of those patients with other types of bleeding disorders. So at about the same time, out of the blue, our CEO at Hemab, Benny Sorensen, contacted me and asked me if I'd have a look at HMB-001, which was a drug that Hemab were looking into to treat a rare bleeding disorder, Glanzmann's thrombocythemia, and they really wanted my perspective as a clinician. And really the timing was perfect, because I looked at this and thought, this is really the innovation that this group of people need. It's what I need to be able to offer more patients in the clinic. And then combined with that, I've just been through the COVID pandemic and seen the value of innovation and working together, and how much we were able to produce in such a short period of time. So yes, the answer is it was a happy accident. I could see what I needed in clinic. I was able to bring my clinical and scientific background to the table, and Hemab was there waiting to produce some of the solutions that we needed.